Okay, to start off with the history, it talks about a 17-year-old soccer athlete. So I'm immediately already thinking something with the lower body, probably most likely the knee, with no significant past medical history, presented with acute right knee pain, which what I had thought, which occurred following a varus stress contact injury during a soccer game. Okay, so varus, that's putting stress on the lateral ligaments or lateral structures. So I'm already running through some of those possible diagnoses in my head. Contact occurred with the opponent while he was initiating a jump in the air. He felt a pop at the time of the injury and was unable to bear full weight immediately following the injury and walked with a limp. So he felt a pop. He could have actually just thought he heard a pop, maybe he got really nervous and there wasn't a pop at all, or there could have actually been some type of structural damage, a ligament maybe, or it could have just been that his knee was just popping. The gas bubbles sometimes within the joints, it'll cause like a popping sensation, so it could be numerous things. He was unable to bear full weight immediately following the injury and walked with a limp. So unable to bear weight could have just been because the athlete was just in immense pain, like they physically just like it hurt too much to walk, or there was so much structural damage to where they actually cannot physically walk, like they are unable to do so. Again, walking with a limp because it hurts too bad, or maybe they feel a little bit unstable. The pain level was an 8-10 at presentation, so this explains why they were unable to bear weight and walk. The pain is just too immense. Pain consistently woke him from sleep and was exacerbated with any exertion or ambulation. So they're having pain with anything that they're doing, even just walking normally, like day to day, like they're still having pain with that. So that could be because of there could be a lot of inflammation, a lot of swelling due to some type of damage within the knee joint or outside the knee joint, some type of structural damage. So of course it's going to cause inflammation, swelling. All the cells are going to come and try to repair the injury, whatever may have happened or occurred. Physical findings. The physical exam. The right knee exam was significant for moderate effusion with significant pain upon palpation along the lateral joint line of the right knee. So lateral, so it's towards some of the lateral structures, lateral ligaments maybe. Some of those were injured in the jump. Moderate effusion, so there is swelling, so something did occur structurally, some type of damage did occur within the knee to cause the effusion to occur. Full extension was present with flexion to 135 degrees. 135 degrees is full flexion as well, so they do have full range of motion, full flexion and extension, so that's good. 4-5 strength was noted with flexion extension of the right knee, so their strength isn't a 5-5 in comparison to their other leg, so 4-5, but they still do have pretty good strength. There was no laxity with Lachman testing, meaning that the ACL was intact. So that is out of the possible diagnoses. Posterior joint testing with lower extremity externally rotated showed laxity compared to the contralateral side, meaning that the PCL ligament, there is some laxity in that ligament, some type of structural damage could have occurred there. Laxity and pain were noted with the varus valgus testing at 0 and 30 degrees, meaning that the ligaments on the lateral and medial side of the leg, they are having some sort of laxity. Again, that could be because they were overstretched, maybe they were pulled, or they could just have a lot of laxity, which is why you would test in both legs to see if the person just has a lot of laxity in general to begin with. Significant pain with Thessaly's testing and McMurray testing along the lateral and posterior aspects of his right knee. So Thessaly's and McMurray, if they are having pain with that laterally, lateral and posterior, so there is some type of structural damage to the lateral or posterior portion of the knee. Thessaly McMurray's tests for the meniscus, so there could be some type of structural damage near where the lateral meniscus are, if not the actual meniscus itself.